everyone. On behalf of the Mindalia TV team, welcome again to Mindalia live streaming. Today we have the great pleasure of having the company of Alfredo Muñoz. Alfredo Muñoz is a neuropsychologist. He is a team coordinator for the Center of Neuroregenerative Medicine. If I'm even saying it right, Alfredo, right? Before starting with him and the conversation that we are about to start, which it's been named a permanent acupuncture as a treatment for Parkinson's disease, I just want to remind you that if you want to enjoy our content, you can also do it not only here but in Mindalia Radio Voz. We are there sharing with you 24 hours of conscious knowledge, and you can go there by just going to www.mindaliaradio.com. I'm gonna now welcome Alfredo Muñoz. How are you doing today? Welcome again to Mindalia.
Appreciate your kind invitation and allowing us to talk about something that is eventually more and more worrisome for people in general.
Well, Alfredo, one of the things that I wanted to especially thank you for is the fact that you accepted our English invitation. We do this in Spanish. Spanish is our native language, and the only reason why we cross to the English language is because we want more and more people around the globe knowing the information that we keep sharing in our Spanish channel. So thank you for daring to tell your story and what you do in a different language, because it is very challenging. I also wanted to open this conversation by asking you, because we may hear very often the word Parkinson's, right? It's, I guess that anybody in the modern world have heard it and probably has a family member that has it, but we may not be fully aware of the extension, what it is, how does it look. So you're an expert on the field. I want you to just tell us everything about first the disease. We're not going to talk about the patient, but the disease. Then we'll go to the patient.
Of course. Basically, when we describe Parkinson's disease, it's a group of symptoms in which we describe different aspects. One of the main aspects is the body aspect, in which we can see either shaking or stiffness. It was first described as a shaking palsy. And we see different things at a different level. For example, for some patients, it starts with either shaking or stiffness. Then it becomes a little difficult to move around or to get up, sit down, stand up, just crossing doors. And so these are difficult. Basically, what happens is that every movement must be thought out. You must think on every movement that you want to make, and that is something that is not very common for a normal person. You normally do things in a very natural way. So that's basically the basis of the problem.
Thank you for sharing that with us. And how can someone realize, how can someone find out, like, what are the first symptoms? What would bring someone, in your knowledge, what would bring someone to visit a doctor and say, hey, there may be something going on here? And I'm talking about early symptoms, not, the very evident, but the early symptoms. How do they look?
Well, yeah, normally patients start feeling a bit anxious or depressed. That is part of the psychological problem, that patients might feel a little down, a little blue, perhaps, and then they start seeing perhaps a little shaking. It might start with one finger, and they may start with one hand, so they still see this little tremor. And the tremor goes on and off, and then it starts becoming more on. So, and it doesn't go away except when they're sleeping. So what they decide is to visit the neurologist or whatever general doctor to try to find out what the problem is. So after a series of testing and after a series of sorting out different illnesses, because we have to realize that there are many other things that might happen in the brain, we realize that we can give that patient the diagnosis of Parkinson's disease. So it does take a little bit of time before we can just describe and say that it's Parkinson's.
As a psychologist, Alfredo, you get to see the emotional side, the impact of the emotional field of someone that is dealing with Parkinson's disease. Not only the person themselves, but the people around them, partners, children. I want you to tell me about what's the impact on that side. You know, not only the physical, but how does it affect emotionally?
Well, there are many aspects. One of the main aspects, just as you mentioned, is the psychological aspect on it. When we first we have to see 2 points of view: one from the patient's point of view, and the other one from the family around that patient. Once you get the diagnosis, the patient starts thinking about what may become of his or her life after this diagnosis. So that normally gives them this idea of, oh, I'm not going to be productive. I am not going to give or be the first part of the family. So I'm going to be slowly shrinking, and then they're going to have to take care of me, and I'm going to lose my independence, and so on. And from the family point of view, what happens is that they start seeing the patient going a little bit inside, imploding, sort of say. And what they try to do is they try to take extra care of that patient. So they give everything for the patient. They don't allow him or her to cook or do anything or go anywhere. And then they start helping that implosion of the patient. So there are two sides. It is important that we say that one of the most important aspects of the patient is that they lose their independence. And that is a very, very traumatic factor for both sides, the patient and the family.
Yes, it definitely sounds like something that only someone, going through that could even grasp the idea. So I want to be very respectful as we speak about this. We don't want at any point to assume that we would know what's the best way to deal with it, because definitely when you're not in a situation, it's just imagination, right? It's just jump into conclusions. But regardless of that, you and your team, you have been researching, and there's something very interesting because you have brought to our traditional or our culture, to our medicine, you have brought tools from the other world, tools that are probably more older tools that have been working for years, thousands, if I may say so. You do practice acupuncture, and then you turn that into a permanent acupuncture, and you have discovered, like, you have proven to better the life of the people that have access to your treatment, right?
Yeah, and this is very interesting because not everyone has had the opportunity to experience acupuncture. But some of the people that have experience, they have this sense of the energy and their wellness in their body and so on. But they have to go every other month, or they have to be constantly going for this treatment. After a bit of time, we have done research. We have seen that some of the patients, they do not respond to medicine. Pills, drugs, and so on. So we have been searching for an alternative for these patients. Some patients would like to go into more natural ways of healing, working, and treating their illnesses. And permanent acupuncture gives these patients an option, an alternative for treating an illness that can improve their lifestyle. So it's important that it's not a definite cure, it's not a miracle treatment, but it does help the lifestyle of the patient that received the treatment.
Exactly. You have said it before, and I'm going to say it again because I think it's very important that we bring it up. Is the fact that this is not a cure. Like, we're not talking about the fact that you discovered a cure for, but it's a way in which people can still have it and have a better lifestyle, see their habits and their day-to-day improved, but like the symptoms are the ones that are not so heavy probably, right?
Yeah, normally we have to think that this is a neurodegenerative illness. So if we think that the first 1 year, maybe you need one pill, but after 2 years, 3 years, and so on, you need to increase the dose of the amount of medication that you take. Imagine that the treatment that we provide or that we offer for patients allow us to stabilize that patient, that allows us to have or to take the same amount of medications throughout the years. That is a big improvement. And this is what we've seen in our studies and in the research that we've seen. So that's the important part. What we want is to offer a patient the possibility of receiving another treatment that will help either their medical or their traditional treatment and improve their lifestyle. That's basically what we've offered and what we've seen on patients.
And now the $1 million question: what is the treatment about? How is it? How does it work?
With acupuncture, we have seen that we stimulate the body in a different way. And we have seen that there are other options of acupuncture. We've seen the needles that you normally use in your body. That's the traditional acupuncture that pretty much everyone knows and has seen in movies and so. And then there's another one that it's right around the ear. So what we've done is we've adapted the ear acupuncture into a permanent acupuncture. So they're tiny little needles that are implanted under the skin that allows us to stimulate constantly certain parts of the body and certain parts of the energy, and allows basically the patient to feel better throughout the time and without the needing of going again and again into the practice of an acupuncturist.
Thank you, Alfredo. So this is what you're doing at the institute that you are part of, right? And that institute is mainly in Spain. I want you to talk about where you are, and I understand that you also offer. Sometimes you just move around certain places, right? People can have access to your treatment in other places, not only in Spain.
Correct. Basically, we're based in Spain. The therapy was developed in Germany, but it was the center was moved into we moved in Spain. But we know that sometimes it's very difficult for patients to travel around or to go to Europe and receive the treatment. So what we do is we reach doctors in different countries and we travel to those countries in order to treat patients. So that is a possibility that we have. We've traveled to different countries. We've basically been into Canada, Mexico, different countries in Latin America, different countries in Europe. So what we do is we try to reach out for patients. Instead of the patients going to us, we try to go out and work with patients.
That is very interesting, Alfredo. Um, of course, I wanted to ask you if you could share with us some examples about how, um, what areas, like I want to go a little bit deeper probably on how is the improvement of the people that are receiving the treatment that you offer at the center.
It's very interesting because it is a chain of different events. One of the reasons why patients have the need of medication is because if they take the medication, they can be a bit more independent and they can move a little bit more freely. What happens is that the medication has a lot of side effects, lots of side effects. Perhaps you cannot sleep, maybe you have digestive problems, maybe you have a whole amount of symptoms that come associated with medication. Sometimes there are more side effects on the medication than on the Parkinson's itself. If we treat the patient and the patient feels better, has a lot less tremor, or perhaps it's a little bit more flexible, instead of having the stiffness a bit more flexible, they would have less need for medication. With less need of medication, you have less side effects. So it all becomes better. They take less medication, less side effects, less symptoms, and the patient's life becomes a lot better.
It sounds like a very kind way of dealing with it. Do you do these for different degenerative diseases or only for Parkinson's?
Well, this works very well for different illnesses: Parkinson's disease, Alzheimer's disease, um, chronic problems such as chronic pain. We also have this. So there are different things that can help the patient in a neurological way. Normally, patients have different symptoms and they have very different names for basically the same symptoms because they are affected in different parts of the brain. They have a different name, of course. But what we try to do is we try to work with chronic problems, with neurodegenerative illnesses. Sometimes they have similar names, sometimes they have very different names. But basically, what we try to do is that we want to improve the patient's life. And for that, we need to see what other problems, what other symptoms the patient might have. But basically, it's chronic and neurodegenerative illnesses.
Thank you for specifying that. There is something that I also found interesting when we had our conversation in Spanish, and is how you can better a very important life of any couple, and it's the intimacy. I remember that you were talking about how intimacy, like sexual intimacy, can be very, very challenged due to the effect of that side effect of the medication. And I think that's something super important because it ends up, you were telling me about how, again, the emotional side of the patient is very affected given the fact that they cannot perform. And I think that's something that's worth bringing up if you can talk about it a little bit more.
Yeah, oftentimes we see that the age of the Parkinson's patients is they're younger and younger. In the past, we saw patients that were 60, 70 years old, but now we see patients that are 40, 45, 50, 55 years old. That is considered very young in this day of age. So what we try to do, what we have seen is that the medication, one of the side effects of medication, it increases willingness, it increases the wanting of more the sexuality of the patient, it increases it, and on the other hand, it allows to for more erectile dysfunction. So you have the two sides. For in one side you want more, and in the other one you cannot perform, and that leads to a lot of frustration. That leads a lot to intimacy problems with couples and so on. So if we decrease the medication, we see that the libido of the patient becomes normal and they can perform a lot better. So that allows the patient and their couple and in general a better lifestyle, because that's one of the biggest problems that we've seen with patients, that very young patients do not have the opportunity to have this part of a very important satisfaction in their life. So it's some for some patients it becomes a real big problem.
There is something very interesting that you're saying, and is how we get every time younger and younger people are facing these problems. So, what do you think this is for? Like, why?
Normally, we've seen that nor high amounts of stress in everyday life is affecting it's affecting patients. We've seen CEOs, we've seen lawyers, stockbrokers, general work professions that have very high amount of stress in daily basis, basically are very potential patients for developing either Parkinson's at a young age and other neurological illnesses. So we've seen that stress plays a very important role on patients developing this kind of illnesses.
Thank you for that answer, Alfredo. I also wanted to ask you about how can family members actually be a good company for someone that is going through this, and how is the life of the family members also improved when people start getting the treatment?
Well, we have to think that the family members they start taking care of a patient with all the love and care, and then this becomes something of a loving action. This is very it's very normal to wanting to take care of our patients, our family members, our parents, couples, and so on. But as days go by, we have to remember that this is over years. This is not something for 1 or 2 weeks. This is over time. So after 5, 6, 7, or 10 years of taking care of a patient, you really start realizing that it's a very heavy burden for everyone. So we have to think that independence is a very big problem for both patients and caregivers. And what we do is we want to give back this independence for everyone. Because as caregivers, if you get your independence back, you start feeling freer, you start feeling better, and you start giving this care in a very natural way. You don't see it as a burden, you see it as something you want to do. So, in our center, we have developed a program in which we allow caregivers to take a bit of time off this 24-hour burden, because it's very heavy for the patient and it's very heavy for the caregivers. You cannot take care of a patient 24 hours a day, 365 days a year. It's very difficult. It's very, very difficult. So you need to take a bit of time off, a bit of time for yourself, and regain back the patient and the person, so they can both feel a lot better. It's very important. It does take a lot of time and a lot of work from both sides. It's not easy.
Yeah, thanks for that answer also. Alfredo, what have you learned so far about this? I'm pretty sure that after being for so long facing these and exposed to so many stories, family stories, if there's something that you would cherish and say, you know what, this, finally I was able to understand this, what would that be?
Most of the time, we work with the patient, neurologist, um, and medical doctors. They work with the patient. They give the medication and they say, okay, you've got Parkinson's, take this medication and we'll see you in a few months. What I've learned is that sometimes, as doctors, neurologists, and sometimes even as a psychologist, we don't take the time to work with the patient to explain what the illness is, what to expect, how everything around them is coming together, and also the family. We have a patient, but the family sometimes is just as important to work with them. We need to explain what is part of medication, what is part of side effects, how this is going to evolve, not to be scared, to work with the patient, to give them options so that the patient can be independent. Most of the time, like we've talked before, is that family want the patient to be pampered all the time. They want, they don't allow him or her to make any chores at home, to prepare any food, nothing. But we have to think that we need them to do a bit of stuff. We need them to feel important, that their life is part of the family and their life is relevant to this family as part of the family. So it's very important that we allow professionals to talk to the patients and to talk to the family. This is very important. This is what I've seen. It doesn't happen that often.
Thank you. Of course, I need to ask you because it's very important to bring it to the conversation. How is the process when someone decides, that they reach to your center and they decide that they want to try the treatment? How is the process? Is it walking? Do they need to make an appointment? What is taken in consideration before starting to apply the treatment?
Um, Basically, what we do is we give information. This is something new for patients. This is something that they have to decide, the patient and the family, because the family is actually very, very important as well. So they get in contact, they get in touch with us through an email, through a phone call, and we give them information. We allow them to read, to see, to learn everything they want to know, and all the questions that they might have. After that, if they have more questions, we give them more information. But this is a process in which the patient must be convinced that this is something for them, that this is something they want. So basically, we give them information, we allow them, and if they have questions, we guide them. But we don't want to convince the patient. We want them to learn about it.
And how is the process of the actual application once someone decide, you know what, yes, this is for me, I want to try it. Does it take long or is it too complicated? I want to know about it.
Well, the implant itself is done by medical doctors. So what we want to do is we want to know the history of the patient. We want to know that the patient is a good candidate for the treatment. So we ask questions, we ask relevant information that the patient might have, not only Parkinson's, but other problems that they might have. And after that, it's a bit of local anesthesia, 30, 45 minutes, and it's basically all done. The following day, we ask to have a control visit. So we make sure that there are no risk for infection or no risk for a possibility of getting something infected. And that's basically it. So in a couple days, and they don't have to stay in the clinic. They can go home, and it's basic care. It's basic care that they don't put anything like the mobile phone. They don't talk on the phone. That they can have the hands free and so on. So we give them a bit of advice, but the process itself is perhaps a couple hours. It's not that long and it's not invasive. So it's very simple.
And what is the needle made of?
The needle is made of titanium. It's a very tiny needle. We use titanium because it's a metal that can blend in your body, that it's basically compatible with our body. That's what we use on kneecaps or hips. That's the only material that we allow. For example, if we use another kind of metal or if we use another element, the body rejects that. So what we need to use is we need to use pure titanium that is allowed in the body.
How often do they need to follow up? Is it necessary to change the needles, for example?
What we do is we do the follow up. We have a control of the patient for 1 year. Basically, we give them a call if they have any questions, if they have any comments about the treatment. Some of the patients might see that some of the symptoms are going away. Some of the patients might have a question about medication. So we basically are there to answer any questions that they might have for 1 year. And after that, basically it's their own. We guide them for a better lifestyle. We let the patients know that the needle itself or the treatment itself is not magical, that they need to do a certain amount of work and certain amount of activities in order to improve. So we kind of guide them for the first year, and after that, they're on their own.
for how long, like, do they need to come back? 2 years, 3 years, 5 years, or it's no?
Yeah, well, basically, after the treatment, after the first year, our doors are open. They can always call us and give us any kind of questions or comments. They might want to do that. There are possibilities that either another illness or another problem might come up. If that is if that is the situation, we do have a reinforcement for the patient, but we don't do that until after the 2 or 3 years. But there are reinforcement needles that might be done for a patient in case they have a question or they ask for them.
And excuse my ignorance, because now you talked about another, symptom. I've heard, I'm not sure if it's completely true, that the degenerative diseases, they tend to come in a bundle. Like it's not only one, that you could be dealing with more than one. In fact, is that right? So it will help for both if they had two or more.
Yeah, the brain is so complex that, for example, sometimes it's very difficult to find a very pure illness, um, described as it's described in books. For example, in books it's described as symptom one, two, three, and four. But sometimes mental illnesses or this kind of neurodegenerative illnesses might have one and two, and then six and seven that are described in another illness. So sometimes they have mixed components. It's not a pure Parkinson's, but different parts of different illnesses at the same time. So it does come in a bundle, but it takes pieces from here and there. So it's every brain, every human, every problem is unique.
It's completely different. Thank you for that answer, because I would say that I'm not sure if everyone thinks the same as I do, but I feel that there's a lot of shadow, there's a lot of fog uh, in between what the people that are suffering through that are going through and what we know. Because something else is that it's not talked as often as other things. If someone is dealing with a kidney disease or a lung disease, it's like more normal that they talk about it. But with these type of things, there's some sort of taboo still going on that would probably keep us in the dark, right?
Yeah, normally patients in general, what they might want, or what they might try to do is to hide the problem. So, for example, if you have like a shaky hand, what you try to do is try to keep it in your pocket so nobody notices. Or if your legs is a bit stiff, what you might want to do is always put it under the table so nobody sees that it's a bit stiff. So we've seen that that is not an effective way of dealing with the illness, because what happens with that is that it increases anxiety, and as you increase anxiety, the symptoms get worse. So what we try to do is we allow the patients to normalize the situation, to allow themselves to see it as a normal problem. Nobody is going to be thinking more or less of them if they see them with a bit of shaking, and this allows them to take that burden off their back and to ease themselves, and that, believe it or not, that decreases the amount of shaking or stiffness in their body. It's amazing. When you're calm, when you're resting, you feel a lot better and the symptoms go down. It's very interesting.
Now that you've been exposed for so long to this, what would you recommend as a lifestyle for someone that is going through it? Like, what's the ideal, again, lifestyle? I don't think I have another word for that.
Yeah. It's very interesting because we've seen that patients, when they have a lot of stress and a lot of anxiety, the symptoms increase. And this is our body talking to us. For example, if you smoke and you start coughing, that is your body telling you that you need to change. when you drink a lot and you start having problems, that is your body telling you you have to stop. With anxiety and stress is a bit more difficult, but that is your body telling you you need to relax more, you need to do a different lifestyle because you are putting too much pressure on your body, on your brain, on your lifestyle. So it's a way of saying that it's your body coughing, but for stress. So everybody somatizes stress and anxiety in a different way. Some people cannot sleep. Some people loses hair. Some people, everybody is in a different way, somatizing their anxiety and stress. So it's the body telling you you need to change or you need to modify a certain amount of things in your life.
Thank you. Lupita Garcia, whom is with us, and I'm not sure where she's at. She didn't say where she's joining us from, but she's participating through the YouTube chat. Has a question. Oh, she's in the US actually. 10 years ago, I got acupuncture for sciatic nerve on my back and legs. There are some parts of my back I have not sensibility, but I feel good because I am fine of my nerve. Why I don't have that sensibility? That's Lupita's question. Would you know anything about that?
Yeah, normally our nerves they do have certain receptors and emitters of body movement and pain receptors. So we, as the sciatic, normally it's because the nerve might be pinched, and when that is pinched, we might be affecting not only pain in our brain, but also pain receivers in our lower back. So that's why she might not be receiving the amount of, she might not be able to stimulate the pain or the body sensation in because it's pinched. So that might be a possibility. But if she has sciatica, it's very important to go to the doctor and find out if there are no other problems associated with the pain. Once we see a complete scan or an X-ray, we can discard any other problems that might be in problem or might be in that area.
Thank you, Alfredo. Also, something that I think is really important is if you have had or if you have noticed in the center side effects to the treatment. Is there something that could come after it that is not as positive as everything else? Or because I normally heard that acupuncture it's pretty much innocuous. Like it's hard that it will give you a side effect. In this case, which is not a session but a permanent acupuncture, would it be the same?
We've seen with lots of with a number of our patients, and we have not had a side effect. The only problem that might come up is that if the patient is not taking care of the ears the first 1 or 2 days, there might be an infection associated to it. But after that, everything should be normal. Another problem that might be is one person out of I think 1 million or 10 million or so, it's allergic to titanium. But that is one person in, like I said, millions. Normally, titanium is a very safe material to work with, and that is what it's used in everyone. But in general terms, we have not had any side effect. That's the only two things that we need to be careful with.
Well, we're reaching the end of our conversation, but there's still a couple of things that I want to ask you about. The next would be about your team. Who are in your team? What are the professionals that are part of the center? I want you to tell me a little bit about it so people know who they're gonna be talking to. Like what type of what's the expertise behind the center?
Well, basically, in our team, basically all the team is they've had contact with either German, either they're from a German family or they come from German. So they do speak not only German, but they speak English, Spanish, and they speak several languages. Our team is made of myself. I am a neuropsychologist. We do have medical doctors that do have lots of experience, not only with neurological illnesses, but also with acupuncture. And that is a very interesting mixture because most of the acupuncturists, they don't have the medical title, or most of the medical professionals do not have any knowledge in acupuncture. So it's a very interesting mixture. And what we basically want is for the patients to feel safe. So Parkinson's disease is a very serious illness in which patients do take a number of medications, and we want to make sure that they're well taken care of. That the professional that works with them is very well acquainted with all the illness and side effects. So it's a medical doctor that will work with the patient all the time.
Thank you. I think I want to recap a little bit before we leave, okay? We've been talking about how you are part of the Center for Neuroregenerative Disease, right? You work in Spain. You travel around the world. You bring the treatment to people if necessary. I want you to repeat a little bit about what you offer. What are you offering to people? Is it a cure? Is it a symptom reliever? Because we are almost reaching the end, and I think it's ideal to recap a little bit.
Absolutely. Well, in our center, we offer an alternative treatment for Parkinson's disease illness and patients, or other neurodegenerative illness that might come up. And we give them an option. We give them an option in which drugs, medication, or plain and simple, they don't want to go into this path of taking drugs and medication. It's an alternative for the relief of their symptoms, stabilization of the symptoms. We don't want them to go any further or increase. And we want for patients to have a more independent lifestyle, to feel better, to reduce the amount of medication and reduce the side effects. That is basically what our treatment offers. It is not a miracle cure. It is not something that will cure Parkinson's or Alzheimer's, but it would certainly give you the possibility of regaining a lot of your independence and a lot of your life with this treatment. So that's basically what we offer.
Technique that puts together acupuncture from the old world and modern medicine. Like, it's not that you are just bringing that, it's that you are able to combine the expertise from two different fields, right?
Correct. Basically, it's we sometimes traditional medicine, thinks less of acupuncture, but now that we've worked with acupuncture, we don't think less of traditional medicine. We think that the both can be working together and can help the life of the patient. So that's important. That's basically what we want to do. We want to give the patient the opportunity to try a new option, something different for them, and that is more natural and that it does not involve traditional medication, drugs, or any other pills that they might require by their normal doctor.
Thank you again, Alfredo. We now reached the end of our conversation for real. I know I've been saying this for a while, but now it's really time. And thanking you would be the first thing that I want to do for joining us in this space in English, for bringing it to another language. But before leaving, of course, I want to give you a moment so you give us your closing thoughts and then our goodbyes, of course.
Well, first of all, thank you very much for the alternative, for the option of allowing us to express and to tell patients that of this alternative. And I understand that this is new. This is something that not a lot of people know about. But I invite all the patients to read a bit about our treatment, to read about our option that we offer, and perhaps it's something for them. It's a natural way of working and healing with their body, and perhaps it's for them.
Well, thank you again for bringing this to us and to the people that are with us. Just thank you. Thank you for joining us. Mindalia.com is an international nonprofit organization. You can collaborate with us. You can like our content. You can leave us a positive comment, because when you're doing that, you help us reach as much people in the planet as possible. And you help us, of course, gather information and bring people like Alfredo Muñoz to this space. Once again, a big hug and all our gratitude, and we will see you again in a very, very soon Mindalia live streaming. Bye bye.